Welcome to Stretch and Exercise class. If you've been invited to this class, you would have been starting to feel a little bit better, function a little bit better, and we'll be seeing some stability with your adjustments. You would have been given this sheet, which we hope that you've already started, but if you haven't, we're going to be running through these now, and we're just going to be making sure that you do them correctly. But before we go through these stretches and exercises, I'd just like to run through some things that we should all be doing regularly. The proper way to stand. Your feet should be about as wide apart as your shoulders, and your knees should be slightly off lock, so it's called soft knees, and you should lean a little forward. You open the space up between your belt buckle and your sternum, and it's like somebody grabbing your hair and pulling you up and back. Now your hands should either be by your side or behind your back or in front of you, right? Now this creates the platform because the strongest muscles in our body are our legs and our glutes. So this creates the platform for bending, twisting and lifting. We should always work straight in front of us, and we should bend our knees and keep our spine as straight as possible. And when we're coming up, we could come straight up. If we have an object, it should only be light, we keep it close to our body. If we have to do something to the side to avoid twisting, we should move our whole body nice and upright in this plane. Then we lower the object. If you can't do it that way, if you're putting your legs back and using your body as a crane or leaning forward, you're inviting disc damage at some stage. You may get along, you might get away with it for some time, but eventually it will catch up with you. So nice and upright. This creates a platform for phones, reading. At a standing desk, computers, always at eye level. It's pointless having a standing desk if you're standing and your head is still forward. So always in front of you. The proper way to sit. We're sitting more and more. It is counterproductive. It's very, very stressful, particularly on your low back and your neck. So there is a proper way to sit. And we're going to run through the improper way first, and then I'm going to show you the correct way. Most seats, unfortunately, the knees are up higher. This tends to sag our back deep into the chair, and it starts to move our head forward. And then if we're on a computer or a phone, this is text neck, puts a lot of pressure on the neck and the low back. So we need to avoid that. The best way is to have the knees at the same height. Same as standing, we need to open up, always work straight in front. Computers at eye level, phones, reading at this level. We can get a bit of mechanical assistance here by putting a cushion or a roll in the small of your back so that we're nice and upright. Great for your central nervous system, great for your spine, great for cardiovascular and lungs. Even better if we can get our knees lower by using a wedge. I like this because you get a little bit of a workout as well. Now my knees are lower, and as you can see, without too much effort, I'm nice and upright. Phones, computers, and with this, we can get a little bit of a workout which keeps the cerebral spinal fluid pumping up and down our spinal cord, which will keep you more focused. But still, sitting should have a limitation of 45 minutes to an hour, and then you're going to need to get up and have a walk. So you need to get up, move around, and then come back to the sitting position. Have at least a 5 to 10 minute walk. By now, you should have your pillow. This is an essential part of getting better results faster. I'm going to show you how to use this most effectively, and you will finally get used to it. And if you're like most people, you'll never be able to sleep on anything else again. So there's the two positions on your side. The lump here fits in to your neck. This will have the effect of keeping your spine nice and straight. This is going to help keep it supple and in its right alignment to help communication from brain through to the rest of the body. The next position is on your back, and this is the one that we prefer you to sleep in if possible. This fits in behind the skull, the occiput, and it has the effect of bringing the arc of life or the lordotic curve back into the neck. That's if you can sleep on your back. If you can't fall asleep on your back, then just turn and complete the rest of the night on your side, and when you wake up, spend some time on your back. We're going to start on the exercises now. Ideally, in a perfect world, we'd like you to do 3 repetitions of each of these exercises twice a day. If you're a little time poor, try to do them at least once a day. But don't forget that you need to also walk for 30 to 40 minutes each day as well. And let's try and aim or set a goal for 6 days a week. We'll give you 1 day off. Let's start with the range of movement in the neck. We've got to take this very slowly and gently, never rolling your neck. So first of all, when we do a stretch, we just go 3/4 of the way until you feel a light stretch. You breathe in through your nose and out through your mouth, and then you go further into the stretch. Pain, spasm, clicking, let's try not to push it that hard, just slow and gentle. So we start with the range of movement to the right, the rotation. So Dr. John, if you could turn your head 3/4 of the way to the right, breathe in through your nose, out through your mouth, and then continue the stretch. And we'd like you to do 3 repetitions. And now we're going to go to the left. Come back to the middle, now go 3/4 of the way, breathe in and out, go further into the stretch, and we're going to do the 3 repetitions again. Look straight ahead, Dr. John. Now we're going to do lateral flexion. We're going to tilt your head to the right, just go 3/4 of the way there, breathe in, breathe out, and then go as far as you can into the stretch. Come back to neutral. We're going to do exactly the same to the left, about 3/4 of the way till you feel a light stretch here. When that relaxes a bit, then we go a bit further into the stretch. We do the 3 repetitions of breathing. Straight back up to the top again. All right, what we're going to do now is chin to chest. Just go 3/4 of the way down, breathe in through your nose, out through your mouth, and then go as far as you can here. And we're going to do the 3 repetitions of breath again. Look straight ahead, Dr. John. All right, now we're going to go into extension. Keep your mouth open, 3/4 of the way, and then go back, and then close your mouth, because you're going to get a nice stretch at the front. You do your 3 repetitions of breathing, and then just come back to neutral. We'd like you to do these repetitions 3 times, at least twice a day, or if you're stuck in a traffic jam, or if you're feeling some tension at work, just get in the habit of doing it, and a couple of little shoulder rolls as well through the day as well to break up that tension. This is a very powerful exercise. We like to recommend some caution. So we're going to take it slowly and gently. We need a bathroom towel rolled up. You're going to hold it at a part a little bit wider than your shoulders, like Dr. John has here. We're going to bring the towel above your head. If you have some problems in your shoulders, even if it's a little bit forward of above your head, that will be fine. We're in this position here. We're going to bend to the side, not backwards or forwards, but in the plane of the body, 3/4 of the way. You breathe in through your nose, out through your mouth, and then go further into the stretch. Just gently, don't push it. You're going to feel a nice stretch on this side of the body here. If you're feeling pain or pins and needles, or it's irritating a disc, you've just gone too far. Build up to this one. Okay, Dr. John, come back up to the top, relax, and then we repeat on the left-hand side as well. Okay, this is a very gentle stretch, and it has the effect of mobilizing your spine, particularly if you've been standing or sitting for too long. It's going to open up the vertebrae, get them moving. It's going to pump the cerebral spinal fluid up around the brain, down the spinal cord. So we get down on our hands and knees. The hand should be directly underneath the shoulder. The hip should be directly over the knee. The first position is we're going to look between our legs and arch our thoracic up. Breathe in through your nose, out through your mouth. You do that 3 repetitions. Then we slowly drop our stomach down and we look up to the ceiling. See the nice bend effect here, opening up all the vertebrae, helping the discs regenerate, keeps the central nervous system free. Then we're going to go back into that position, and if you're confident with this, then you can do it in one smooth movement. You're down, now look up, Dr. John, drop your stomach down, good, and then one more, look down between your legs and bring It's there. Good. This very important exercise needs to be done slowly. You need to be lying on your back. We're just going to demonstrate it on one side, but obviously you need to do it with both legs. So lying on your back, you grab your first knee, which is the left knee. You bring it halfway in towards the left shoulder. You breathe in through your nose, out through your mouth. Wait till it relaxes, and then bring it closer to that left shoulder. Breathe in, out, 3 repetitions, and then you straighten straight out. Always remember, the leg that's not being brought to your chest, the other foot needs to be pointing perpendicular up to the roof. With the same leg, the left, we're going to go diagonally to the opposite shoulder, not straight across your body to the hip, but towards the shoulder. You're going to feel a nice stretch in the glute, the sciatic area, and the sacroiliac. And then go a little bit further in, 3 breaths, and then straighten out. Good, always nice and slow. Have a little bit of a rest, then you're going to do it with the right knee up to the right shoulder. You come back, then diagonally across to the left shoulder, and then you're going to bring both knees comfortably towards the chest. Good. Do not crunch this in, just comfortably. 3 breaths in, 3 breaths out, and then straighten out. Nice and comfortably. The next exercise is going to start to build up some abdominal strength so you can hold your low back adjustment. And when your low back adjustment's holding, it's going to help with the neck as well. So we'd like you to lay on your back comfortably. Bring your hands up behind, but not around your neck or head. This is the muscle group that we're exercising. So we start by contracting here, and our head and shoulders will come up off the ground. You look straight up to the roof. Breathing in through your nose, out through your mouth for 15 seconds. Do 3 repetitions, and then back down. What we're trying to avoid is hands behind the neck and looking between your shoulders and going there, because we can see how damaging that is. That's going to undo all the good work we're doing in the practice. So lie back and relax. The last exercise we are asking you to do is for the core. There is a lot of different ways to exercise your core. This is the safest, and it's an introduction. So the core, we're lying on our back comfortably, and we're going to lift the pelvis off the floor gently so that the knee is in line with the hip and the shoulder. This is a nice relaxed position. You breathe in through your nose, out through your mouth, 3 repetitions, 12 to 15 seconds, and then slowly lower down to the floor. Then you're going to do the next repetition. What we're trying to avoid is overdoing this, where the pelvis is up higher than that line, and look at the damage happening to the neck. Let's avoid overdoing this exercise. Just come up to a comfortable position. Okay, we've completed the exercises that we request at this stage of your care. Thank you very much. All right, okay, so I actually do a